Come in.
Hi there, Mr. Smith. I'm Ashley. I'm going to be your practical nursing student today.
Hi, Ashley.
We've received orders to suction, do a nasopharyngeal suctioning. It'll kind of help pull up some of those secretions that you've been unable to cough up yourself.
Okay.
It might be a little bit uncomfortable, but we will take breaks. Each time I suction, it'll be no more than 10 seconds because we don't want to take out too much oxygen, and then we will give you a break in between each time.
How far do you have to stick that tube down?
Not very far, just to the back of your throat.
Okay. Okay.
All right, so first I'm going to do some hand hygiene. Can you tell me your name and date of birth?
John Thompson, 7/28/50.
Okay. And do you have any allergies?
Nope.
Okay, check your name band. All right, so first I'm going to put a towel on you so that we don't get your gown all yucky.
Okay.
And get all my supplies together. Have you ever had any kind of surgery on your nose or been kicked in the nose by a horse or any animal or any accidents or injuries to your nose?
No,
you know
not that I know of.
Any trouble breathing out of your nose?
No, just my allergies sometimes.
Okay. I'm going to raise your bed up closer to me. So I'm going to look in your nose and just make sure I have a patent airway. Okay. Everything looks good there. This is going to be a little tissue in case we need to wipe your nose off. All right, I'm going to get the suctioning ready. The suctioning is typically 80 to 120 millimeters of mercury. It's on continuous suction.
Why do you choose continuous suctioning?
Because once we hook up the suctioning catheter, I'll show you that there's a little piece where we can control it. So we want it on continuous, and then I will control when it suctions using my thumb.
Okay.
So we have our lubricant, and I'm going to open this sterile package because this is a sterile procedure. Oh, before I open it, I'm going to check and make sure that the package is not compromised, that it is still within date.
Okay.
Okay, so we're opening the package away from us. It's okay if it rips a little bit. This is what's sterile here in the middle. And the outer 1-inch edges are what's not sterile. In your package, it's got your container that you're going to hold your sterile water in, so we can go ahead and open that. Okay. I'm also going to go ahead and check my sterile saline and make sure that it's in date. And actually the date gets put on it when it is opened. So this bottle has not been opened yet. When it is opened, you put the name, you put the time and date on it and of when you open it, and it's good for 24 hours. So I'm going to pour the sterile saline in my container. Okay. Set it down. Alright, and now I'm going to open up my packaging here. Like I said, the outer 1-inch is not sterile. Okay, I'm going to pick up my gloves. Okay, so now both my hands are sterile. So I'm able to pick this up. Your right hand, your dominant hand, whichever one that is, your dominant hand always stays sterile. So for me, that's my right hand. So I'm going to break sterile fill with my left hand when I connect this tubing to the suction. Okay, I've connected it. coil this up in my hand so I have some control of it because I'm keeping this side sterile. I want to test the tubing to make sure it's all patent. So as I said earlier, where my thumb goes here, this is what controls the suctioning. When I put my thumb over the hole there, it suctions. So we're going to test the line to make sure it's patent. I'll put it in here. And yep, it's pulling it up in the line. Okay, so now I'm going to dip the catheter tip into the lubricant. We're going to go up the right nair. So I'm going to tell my patient what I'm doing. I'm fixing to place the catheter into your nose to do some suctioning, and I will not suction until it starts coming out. So we put it up the patient's nose, and we go back as far as it takes for the patient to start coughing. Should be in the back of the throat. So the patient's now coughing. And as I pull it out, I'm going to intermittently push my thumb over the hole to suction and do a twisting motion with the catheter tip. And in between each time, you're going to clear the line of mucus. Okay. Apply some more lubricant. We're going to go up the other nair. Okay, and as I'm pulling it out, again twisting, and I'm controlling it. We don't suction more than 10 seconds at a time because we don't want to take all their oxygen away and cause their oxygen saturation to drop, and we want to give at least a 20-second break in between. If your patient you start to notice that they're in some sort of respiratory distress, of course you want to stop. And then while we have this tissue here, if you notice that they've got some drainage on them, now would be a good time to wipe them off. Again, we would clean the line in between.
How far in can you stick the tubing?
You really just want to stick it into the back, to the back of the throat until they start gagging.
Okay.
And now that we've done the nose, if there's any secretions in their mouth that we need to suction out, we can do that now. You always want to do the nose first and then come down to the mouth. You can't ever go from the mouth and then back up to the nose because that would be introducing bacteria into that sterile environment. Okay, and once you're done suctioning, you can wrap the catheter up in your hand like so, and then pull the glove over it. You can throw it away. Okay, that's it.